For joining us for this public health town hall on advancing equity for caregivers in communities. We'll be talking about the importance of equity in addressing our dual challenge around COVID-19 and in improving brain health. So thanks so much. I'm Jason Resendez, Executive Director of the UsAgainstAlzheimer Center for Brain Health Equity, which is supported in part by a cooperative agreement with the Centers for Disease Control and Prevention's Healthy Brain Initiative. Very excited to be co-hosting today's town hall with AARP and the Bold Center of Excellence in Dementia Caregiving. We have an amazing lineup of experts and doers who are doing this work in communities to advance brain health and to advance equity in our response to COVID-19 and related comorbidities like Alzheimer's and related dementias. And then also importantly, we'll hear from a caregiver, Ms. Vanessa Brown, who is navigating this in real time, in real life. The issues that we talk about, the data that we talk about is real for so many American families. So we'll get that perspective today as well. So thank you again for joining us. A couple of housekeeping issues. We will have question and answer opportunities at the end of each section throughout today's town hall. We ask that you use the Q&A function in Zoom to submit those questions, and we'll get to as many of them as possible. So with that, I want to start with our co-host, Sarah Locke. From AARP. Sarah Locke is the Senior Vice President for Brain Health at AARP. We're excited to have a conversation with her about the amazing work that they're doing to make brain health and COVID-19 education relevant and interconnected and also accessible to families, communities, and expert stakeholders as well. I will note that unfortunately, Dr. Khan is unable to join us today due to some emergency caregiving responsibilities that he has to engage in. We certainly understand that given the work that we're all engaged in, and we wish him the best. So with that, I will turn it over to Sarah.
Thank you, Jason. It's a great pleasure for me to participate on the panel with everyone today. And I want to thank especially Us Against Alzheimer's, the Center for Brain Health Equity, and the Bold Center of Excellence. I look forward to our working together in the future. Talking about it is one thing, working and rolling up our sleeves and really doing things about it is another. But I so appreciate this opportunity to have this conversation to focus on COVID-19 and brain health. If you could move to the next slide, please. So AARP convened the Global Council on Brain Health. We've been doing this since 2015, but that's because we know people who are older care about their brain health. And we know that there are more questions about it than there have been traditionally answers. So we've convened the world's leading experts on brain health and have them address issues one at a time. But when we brought the council together last year, they said, we want to do something different. Usually we're looking at a whole body of evidence of science and then making recommendations on the state of the science. But COVID is developing, but it's such an urgent issue for all of us and in our communities. And it's so intimately related with brain health that we have to do a special report on COVID and brain health. And so I'm going to give you the highlights of that report today, and it provides some context for the conversation that the rest of the panel is going to have. So when we looked at this issue of COVID and brain health, we realized that this is an all of society approach that is fundamentally needed to address COVID. We know the startling statistics of the millions of cases of COVID and the 3 million deaths worldwide. But when we looked at the underlying information about what causes it, who's affected by it, we knew that there were lots of factors having to do with people's age, non-modifiable lifestyle factors that made them at greater risk than COVID. So our report calls for local, national, and international efforts to address the issues laid bare by COVID. And we need people working together, all in, against COVID. Now, we know that 94% of older adults in the US are concerned about COVID. And not surprising, that's because 8 out of 10 deaths in the United States from COVID has been in people older than 65. But we are also aware that there are vulnerabilities, particularly people living with Alzheimer's or dementia, who are twice as likely to get COVID and suffer significant illness as a result. So that's why we did this report, and that's why we focused on equity issues as a primary issue, or fundamental topics we needed to address in order to appropriately address COVID. Next slide, please. So I've mentioned age, but we had to look at these other factors, that age alone did not determine the severity of your illness or how you struggle with the disease. Fundamental things like your income and your vulnerability because of your socioeconomic conditions, your pre-existing conditions, and your health your health status, largely because of the environment and the social environment in which you live, your daily habits and health behaviors, things like that were very individual, like did you wear a mask or not, but say things behind or out of people's control, like what kind of work you were in, or what your race or ethnicity was, because all of these factors combined to make your risk factors significantly different than others without these kinds of risk factors. So if you turn to the next slide, please. The social determinants of health showed us that over and over again, low-income individuals were harmed and infected at greater rates, because not just because of their essential health conditions, but because of who they were and what their economic foundation was. If they were essential workers, they didn't have the ability to take public health measures of working from home, as I have been fortunate to do, for example. Lack of access to healthcare services, tremendously different, resulting in poorer overall health to start with and higher mortality rates due to COVID. Next slide, please. So taking a look at vulnerable populations and understanding that it wasn't just services available or not, but people's fundamental lack of trust in the healthcare system and whether the information that was coming to them could be trusted was a huge and continues to be a huge issue. Lack of access to the skills or means of telemedicine, when other people might be able to get healthcare, existing healthcare through telehealth because they happen to have a broadband connection. But in your community, if you don't, how are you supposed to get your healthcare virtually if you don't have that? Vaccination registration, how frustrating has it been for people who want and are trying to get the vaccine? And there's simple ways for people who can stay at their computer all day. But for those who can't and are out delivering the essential packages that everybody else needs to live, can't be working the phones the same way. And finally, people living with dementia and Alzheimer's, so significantly impacted. And when I talk about people with dementia, I'm talking about people living with dementia who have the disease and their caregivers, because both of these, this dyad, are the people who were negatively impacted by social isolation, because in some instances, caregivers were separated from those who they were trying to protect. Changes in eating and sleeping habit, and lack of cognitive engagement and exercise, increased mental stress, all of these things exacerbated the problems that we're experiencing from COVID currently, and certainly exacerbated who was more significantly harmed. So I know we only have a short time, so I want to get right to the recommendations, because the Global Council made 10 specific recommendations directed to individuals, but I know that many of the people on this call are public health officials. And so I wanted to take the time to say, there's much more backing up this information in the report, but these are the high level recommendations, what people need to do in order to protect their brain health through COVID. And yes, we think of it as a neurological or rather respiratory disease, but frankly, it's really affected the neurological systems of the body, including the brain. And so all of these factors, including ones that you might think are common sense, like exercise and maintaining a good diet, maintaining sleep, those are almost givens, but people aren't doing them. And so we need to reinforce that they do. All of these things, and I would say I want to focus particularly on don't push off medical appointments. We have to tell people to take care of themselves in COVID and avoid too much social connectivity in the wrong ways. But people are harming themselves by not getting their diabetes checked, or not getting their cancer screenings, or not getting their other vaccinations. So the message is that you have to maintain your medical care is vitally important to protect your brain health. And paying attention to sudden signs of mental changes. If you have things like confusion or brain fog, those are very important things, not only if you are experiencing COVID, but in fact, older people who went to emergency rooms were presenting with delirium and not any of the other common signs of COVID that you heard about, like the cough or difficulty breathing, but actually going right into delirium and unable to function that way. I think I'm running low on time, so let's get to our last slide. Lots of little words here. So I just encourage people to take a look at them after the fact. This is all the research we need. We're very concerned about the effects of COVID on brain health, but the long haul and what, for example, are people experiencing and not resolving or getting better over time? These are really important factors to have new research on. Things like, how is it affecting mental well-being, mood stability, and emotional function? All of these elements are things that we need to have research on if we're going to come out of this. And as we've been hearing lately, build back better. But we need answers to these questions. And I hope that you all take a look at finding ways to encourage them. Jason, I'm hoping that I didn't take up too much time.
No, thank you so much. And I want to address a few questions before we move on. One, just a reminder, please, folks, if you have questions, enter them into the chat or to the Q&A. I'll be monitoring both. One easy question, Sarah, is where can folks access the report? We will share a link, but Sarah, if you want to put a plug in for the Council on Brain Health's website. Thank you.
Go to Global Council on Brain Health, all one word, globalcouncilonbrainhealth.org. That's the vanity URL, and you'll see our report there. But if you don't have time to read a 20-page report with all the information about it, we try to boil them down into one-page infographics. And we have one on COVID and brain health, and we've got it in French, Spanish, Chinese, and Arabic. So please go to globalcouncilonbrainhealth.org and get the tips that you can share freely with others. It's downloadable. Please take in and share with anybody you think can use them.
Excellent. And one of the things that I really appreciated about the report, which I think is a key lesson for the stakeholders on the call or in the town hall today, is how you integrated a social determinants of health lens into the recommendations, right? We're not thinking about this just from a race ethnicity perspective, a gender perspective, but really thinking about this from a social determinant perspective as well, which is key to driving equity. And related to that, we have a great question from the audience asking about any information in the report related to rural individuals or rural family caregivers. I think that's a great question, and I'll turn over to Sarah.
It is a great question. We didn't speak specifically to rural caregivers, but we talked about access, and we talked about what might be some barriers that were challenges for caregivers and those living with dementia. So the fact is that where you live geographically makes an enormous difference for the social determinants of health. But we didn't look at it specifically for rural versus urban, but we talked about low and middle income countries. We were trying to span the globe and talking about access to healthcare generally. So of course, your rural areas have a far greater challenge at getting connected to services than your urban or suburban communities.
Excellent. Thank you so much, Sarah, for that overview. And again, we will make the report available in a wrap-up email, along with a number of resources that will be shared today from our presenters and also from the CDC as well. So I'm excited to move on to the next section of our conversation and want to introduce Dr. Lauren Parker. Dr. Lauren Parker is with the Johns Hopkins Bloomberg School of Public Health, and she also co-leads the Health Equity Task Force of the BOLD Public Health Center on Excellence in Dementia Caregiving. Very excited to introduce Dr. Parker, who will introduce and be in conversation with Miss Vanessa Brown, a family caregiver. And without further ado, I will turn it over to you, Dr. Parker.
Thank you so much, Jason. It's a pleasure to be here. And today I'm so grateful that Mrs. Vanessa Brown has came and so graciously offered her time to give a perspective from the caregiver and living with COVID and being a caregiver for somebody living with dementia, to share some of the experiences that she's had. So I'll go ahead and say thank you, Ms. Vanessa, for going ahead and being a part of this. To get us started, Vanessa, can you provide us just some general information about how long you've been providing care and who you're providing care for?
Yes. Hello, everyone. Thank you for having me. And Lauren, thank you for inviting me. This has been a pleasure for me. I have a 95-year-old mom, and I've been her caregiver for about 4 years now. She has mid to late stage dementia, but she's physically okay. She's just, I mean, she's still walking and talking and things like that. I mean, so it's been about 3 years. I'm sorry, 3 to 4 years. And it's been a challenge to say the least.
I could imagine. So I know that I sit in the ivory tower and I think about what goes on in the day-to-day life of a caregiver, but can you share some of the ways that COVID has impacted your caregiving responsibility?
Oh, definitely. Well, my mother was in an adult daycare program, and it worked out well. A bus came and picked her up in the morning, and I got her dressed, and she looked forward to going. And I put her on a bus in the morning, and she'd go out about between 8 and 8:30, and she'd come home between 4:30 and 5. And so my day was really my day to do the things that I needed to do. I run a small business, and so it allowed me to continue to do that. Once we realized, my brother and sister realized she could not no longer live on her own. So, but when COVID came around, the adult daycare programs ended. They had to close. And so I did have another lady who came in and helped me, but she would help me like in the evenings after my mother came home from daycare, or on the weekends, but not regularly, just like maybe once or twice, or maybe at the tops 3 times a week. Mm-hmm. So what happened is I had to start using this lady more. Mm-hmm. So, and then there's a whole lot of things. There was a cost difference because the daycare is $90 a day, and we were paying out of pocket. So it was $90 a day. And the caregiver, or the woman who came in and helped me caregive with my mom, I started using her 6 hours a day and paid her $15 an hour. So it worked out about the same amount. The other thing that happened is my mother just started to decline cognitively because I just couldn't, and even with the woman coming and helping me, we just couldn't provide the same kind of activities that the daycare was able to provide for her. They had bingo. She loved bingo. They had, just a regular schedule. They had volunteers that come in from like one of the local high schools, and they would do activities with the participants. My mother participated in like chair yoga, and I already mentioned she loved bingo, but they'd have like knitting days and craft days, and then every day they had like current events. And so they would talk to the participants about what was going on in the world on the level that they can understand. And my mother just was engaged. I mean, she was around other people like her, or more cognitive than her or less cognitive than her. So it was like a community for her. They had a staff of maybe 5 or 6 different, people who were there all the time. It's a small adult daycare. I think they have probably no more than like 20 participants. Okay. So it was very small, it was very intimate. It was a very good situation for my mother. But again, that closed, and they are trying to reopen. In fact, they said they were going to try to reopen in May of this year, which is we're in May. They haven't been able to reopen yet. So there's the cost. I guess the most important thing is just the cognitive decline of my mother since the daycare has closed. As much as I try to like have puzzles and all kinds of activities for her, it just isn't the same when she's in a group and participating with other people. And also just moving every day, just getting up every day, getting dressed, I'm getting her breakfast in the morning, walking her out to the bus, putting her on the bus, and then her coming back, just that engagement was just really helped her to stay cognitively less than, I should say more than where she is now.
So you've seen drastic changes in her cognition since she has. Yes,
definitely. And then financially it costs more. And then for me, the caregiver who was working at an assisted living program on the weekends, she came in contact with someone with COVID. And so she couldn't come back to me. And my sister, who was helping on the weekends, I think what she had was a mini stroke because she can't use the right side of her body. And so I was left to have to put my mother into an assisted living program. Fortunately, the assisted living program is a very small program, and it allows me to visit my mom on a regular basis. Or I shouldn't say visit her, but to go get her on a regular basis. And so I'm able to get her, I always get her once a week, but sometimes it's more than that because I still do things with my mom, like her hairdresser is back doing hair, and we can go into her shop, but she only takes one person at a time in there, and she keeps the door locked, and you have to call her ahead of time. So I was able to take my mom and get her hair cut, which I was cutting her hair, prior to that, during COVID. I take my mother to all her doctor's appointments. So whenever she needs anything, I take her, and even the day that we went to get her hair cut, afterwards I had food with me in the car, in a cooler, and we were able to eat in the car and everything. And, so it was a nice day. So I'm able to see her at least once a week. And then my brother, who lives about 45 minutes away, he comes and gets my mom too on a different day than I do, but he visits with her at my home because I'm like 15 minutes from the assisted living program that she's in. So the goal is that when the adult daycare program opens back up is to get her back in there. I've already spoken, I'm in regular contact with the director, and that's the goal, because I'm hoping that she can regain some of the cognitive ability that she's lost. So it's been pretty, pretty significant.
I can imagine.
Yeah. Pretty significant.
And I know that we could talk all day, and I enjoy talking with you all the time. But I I know that we talk a lot about the different type of burdens and stress that people might have, but how are some of the ways that you find joy during this time? Because it might be some joy still there, but how are some of the ways that you can find some joy during this time?
Well, Lauren, I met you at the yoga studio. So I'm a yogi, and I practice every day. I didn't practice every day during COVID, but now we're back to kind of practicing every day. Or I should say I wasn't in studio practicing every day. But I practice every day. And sometimes I'm taking, 2 or 3 classes a day because I just really need to, relieve a lot of stress. And in addition to that, I have a wonderful husband who is just so supportive. And it's just me and him living here. And, now that my mother's not here with us, it's just the 2 of us. And he's just, just a kind, loving person. And he gives me a lot of support, and he really supports me as it pertains to my mom. So that's been extremely helpful for me. And it's, and I think I told you before, I'm always the type of person where I know that in the worst of times, it's always going to get better. And so I just keep that in mind. And so we've been, it's worked out.
Well, thank you so much. I would say namaste as we do at the end of the Namaste. And thank you so much for sharing your experiences. And thank you, Jason, for allowing us to have this conversation just to shed light on some of the experiences that caregivers are going through during this time period.
Great. Thank you both so much. I think that is such an important conversation to ground the rest of the town hall. And before we move on, we did get some questions. So I want to talk a little bit about those questions. And one I think we're all interested in is, from your perspective, Vanessa, when you started hearing about vaccines and being able to access a vaccine, what were some of your considerations? What factored into your decision making when the opportunity presented it to you and to your care partner?
Well, as it pertained to my mom, one of the conditions of her returning to the adult daycare program was that she had to be vaccinated. That was not a choice for us. And so I've scheduled for her to have it. I scheduled for her and I canceled it because once I was able to schedule it through her doctor in her hospital. And when I contacted them, I asked them what it really didn't matter what vaccination formula was going to be used. And I found out later that, or we all found out later about the Johnson & Johnson and the blood clots. And my mother had a history of blood clots. And she had to have filters put in her groin area like years ago because she was having these tremendous blood clots in her legs. And so when I contacted the place that she was going to be vaccinated, they said they didn't have any idea of what vaccination she would be getting on the date that she was scheduled to come in. And so I canceled it because I'm really trying to make sure that she's not, the Johnson & Johnson they're not getting anymore, but I also went on the CDC website and it also stated that, that the Moderna also causes some blood clot. There's some blood clots and folk reporting to the CDC. So I'm trying to make sure that she gets the Pfizer one because that is the one that has the least amount of issues around blood clots. But we realize that I realize my mother has to be vaccinated, and the goal is that me and my husband will be too. In fact, I think he's already had 1 shot, and we'll be scheduling. And I'm just trying to get her done first. And it hasn't been that easy. It hasn't been that easy. So but the goal is to get her vaccinated first, and then my husband has had 1 of his, and then we'll go ahead and move on to the next one.
Great. Well, thank you so much for sharing that. And I think what you've highlighted is the importance of education, right? Having access to education about the kind of vaccine that's going to be best for you and for your mom and for your family, and the importance of the work that others on this town hall are doing to get that information out and make sure that it's transparent and accessible to these communities and to caregivers, especially given the vulnerability and the different situation that you're having to navigate, not just for yourself, but for your care partner. So thank you. Last question, and we'll go to the next section was, have you been able to leverage telehealth or any other services that have become available during the pandemic?
Oh, that's for me. Yes, I definitely have. My mother has a wonderful doctor. In fact, she's my doctor. And she's also my grown children's doctor. And so we've been going to her for a long time, and she's available to us. I can make a phone call and she gets right back to me. And we have done probably about 3 or 4 health visits since COVID. I'm just talking about my mother's visits at this point. And she has also seen her in person one time during the COVID, more recently. So I think it's wonderful. I can remember the first visit that we had. I did it on my phone because I'm just not technically like a techie. But my mother like looking in the phone and seeing the doctor and saying, "Whoa," and saying hi to her and just responding to her. But no, I think it's a great idea. I'm glad that it's interesting because one of the good things about COVID is that, if there's any good things about it, is that it's allowed people to communicate via the electronically to get a lot more done. And so I think that has been a really good thing. So yes, we've had plenty of about three televisits. Mm-hmm.
Great. Thank you so much for sharing your story. Thank you, Dr. Parker and Vanessa, for that fantastic conversation, for stressing the importance of accessibility, of tailored education, and the importance of both those things in building confidence. And so I think that's so critical, a critical lesson for everyone participating in today's town hall. Next, we're going to hear from an amazing set of doers who are working in communities, leveraging culturally tailored models, working with systems to address a lot of the issues that Vanessa and Dr. Parker were just talking about. And I want to start off by introducing Dr. Jasmine Nakamaya, who is a clinical lead, vaccine competence team, vaccine task force of the COVID-19 emergency response unit at the Centers for Disease Control and Prevention. We're very excited to have you with us, Dr. Nakamaya. We'll turn it over to you from here.
Wonderful, thank you. So first, next slide, please. First, I want to provide a quick framework for our work in building vaccine confidence. We define this as the trust that people have in the recommended vaccines, the professionals who administer the vaccines, and in the system. So that includes the processes and policies that lead to vaccine development, licensure, manufacturing, and recommendations for use. And a person must have trust in all 3 of these facets to feel fully confident in their decision to get vaccinated. And the slide here shows our national strategy, which involves building trust, helping healthcare personnel to feel confident in their own decision to get vaccinated and to recommend vaccination for their patients, and engaging communities and individuals. Next slide, please. I want to highlight a resource that we developed for state and local health departments, health and immunization coalitions, hospitals and clinics, health systems, and other organizations working to increase COVID-19 vaccination uptake. And this rapid community assessment is a quick way to understand vaccine confidence in a community. And this assessment is designed to do multiple things, including to identify communities at risk for low COVID-19 vaccine uptake, to inform future phases of the COVID-19 vaccine rollout, to get an early understanding of what communities are thinking about the vaccines, and plan for potential solutions to increase vaccine confidence and uptake, to identify community leaders, trusted messengers, and other important channels through which you can reach communities. And finally, to identify areas of intervention and to prioritize potential strategies to increase confidence and uptake of the vaccines. Next slide, please. Also, we have several audience-specific communications toolkits to help organizations promote COVID-19 vaccines. And the toolkits contain a variety of resources, which include key messages, slide decks, frequently asked questions, flyers. This is a list of the different toolkits that we have. The content mirror each other. Some of these toolkits are available in different languages. And I want to highlight ones that may be relevant for your work, including ones for public health partners, medical centers, clinics, pharmacies, long-term care facilities, and community-based organizations. And I'll also share some links in the chat that may be especially useful for working with older adults and caregivers, including what older adults need to know about the COVID-19 vaccines, guidance for vaccinating older adults and people with disabilities, and vaccinating homebound persons with COVID-19 vaccines. Next slide, please. So thank you for your time and attention today. And we really appreciate the work that everyone here is doing to increase vaccine confidence and uptake among older adults and their caregivers.
Thank you so much, Dr. Nakayama. I really love seeing photonovelas on, on that list. So excited to get this information out, and thank you for everything that you're doing to work with systems and with communities and with partners like we've brought together to ensure they're empowered with information to build vaccine confidence, particularly related to some of the themes we've talked about around accessibility and the importance of culturally tailoring and adapting this education. Next up is someone doing that amazing work in communities. And what I think is a really innovative approach. I want to introduce Dr. Maria Pinzon, who's a primary care research fellow and assistant scientist at the Wisconsin Alzheimer's Institute. She's also on the board of advisors for the Us Against Alzheimer Center for Brain Health Equity. Really excited to turn it over to you, Dr. Pinzon.
Thank you so much, Jason, for the invitation. I'm so honored to be here among some amazing panelists. And yes, this is a perfect segue. So leveraging social networks, the role of community influencers. So we just heard trusted messengers. This work is about what's the role, how we partner with those trusted messengers to deliver information through social media. This work has been funded by the Wisconsin Partnership Program through the COVID-19 Response Grant. And even though I'm here today, this is let me show you my team. Next slide, please. This team is amazing. And let me tell you, when we think about social media, we tend to think of one intern managing 10, 20 different accounts, but it really takes a village. So the way that we are organized is Dr. Kerry Gleason and Elizabeth Tuxen, they are with me. We are co-PIs for this project. So this started because one of our community advisory boards said, COVID is here, we need to do something. We need to share information. There's so many conspiracy theories taking prey of our communities. And that's where we got together and say, okay, let's form a team. Let's try to find this way to translate the evidence, what we know, into a way that our communities understand it. And since we cannot meet in person, let's use social media. So we recruited our community advocates that are the pictures in the bottom. Venus Washington, Sashi Lawrence, Ashley Benitez, Elizabeth Solorzano, and we also partnered with the Latino Health Council. So the Latino Health Council of the county was already sharing a lot of information in social media, and we found a perfect opportunity to partner with them to support their work and also to learn what's the effect of our messages and how can we make messages more culturally appropriate. We also have a communication specialist, that's Ornella Hill, and George Levi, that he is our media specialist. So somebody that can tell us, hey, this picture, put it on the right side, put it on the left side, change the contrast to make our messages more appealing. So what happens when we start using all of these techniques and all of this information and all partnerships to deliver messages? Let me show you the next slide and we can see. So this is one example. Notice it was January 27, 2021, we share a link to one reputable organization here in Madison and say, hey, the vaccine is here, the information is in Spanish, and this is from the Latino Health Council website. We reach out 77 people. What happens when we make the picture a little more friendly? Let's see the next slide. So this is a kid. Let's get a shot. A little more, it seems more engaging, it seems more attractive. Oh, who is this kid? I like this. Oh, it's so cute. We don't know the same number of people. Okay, maybe just a picture is not working. Let's see what happens when we get somebody that we have a real person that we have seen information around. This is Dr. Armando Villalba. He is a physician from Nebraska. We have shared a lot of his videos. He has a few videos online. So what happens when we share information from a real person? Okay, when we double our engagement. He had very good information. We got we reached a lot of people giving like. Oh, this is great. Maybe what we need is a superstar. Maybe and I remember when we started talking with this, I talked with Jason. We say, oh, maybe we need Ricky Martin to give us a few snippets. So let's see what happens when we get somebody that's recognized. Dr. Juan Rivera, he's in Univision. He's also a physician, delivering a lot of messages, a lot of trusted information. He's on TV, he's on the radio, he has his own website. We only got 163 people reach. Some engagements, so some people stopped and went to see his website or gave a like. But then now we go to what we saw across all of our communities. Our trusted messengers, or day-to-day life, the person that's here on the ground doing the work. Let me show you what happens when that person is sharing the message. 2,000 people reach. This is la señora Yolanda Salazar. She's somebody that I admire and appreciate, and she's amazing. She is part of the Latino Health Council. She's one of our pillars of our community here in Madison. She got her shot, and she shared, I got it. And here's information. If you're over 65, you can get it. 2,000 people. And see that all of the dates are very similar, are in January. This is not like, oh, it was at the end of the pandemic, people is tired. No, most of these dates, all of these images are in January. When somebody sees somebody that they recognize, when somebody hears this message in a video or from somebody that they trust, they are more likely to engage, they are more likely to react. We saw this across all of our communities and partnerships. So this program target the Black community in Madison, the Oneida Nation in Wisconsin, and the Latino community in Lane County. There's amazing work happening on the ground. And this project, we were able to support some of that work. We'll also learn from many of the things that is happening and help us to how do we shift our messaging to make sure that our message really gets across. Thank you again for giving me the chance to show you this. And I'm happy to answer any questions.
Thank you so much, Dr. Pinzon. I'm sure you, despite all this amazing data, I have a feeling you probably wouldn't turn away Ricky Martin if he showed up. But I think that this is such an important lesson that you've just given all of us around, you know, the importance of not just thinking about social media as let's get this scheduled and out and posted, but the importance of really thinking through that strategy for public health outcomes. The importance of thinking through culturally tailoring the right messengers that the community is going to find compelling and interesting, and you have the data to back it up. I mean, I think that's the kind of work that we all need to be doing and embracing in times of crisis and beyond. So thank you for leading the way there. Folks, just a reminder, please start gathering your questions. We're going to turn into a Q&A soon. So if you have questions for Dr. Nakamaya, for Dr. Pinzon, or Dr. Vivian, please start gathering those. And I will turn it over to someone else doing amazing work in Wisconsin. There's something in the water in Wisconsin. Dr. Eva Vivian, who's head of the African American Health Network and professor at the University of Wisconsin School of Pharmacy, doing amazing work on the ground in communities around vaccine confidence and COVID-19 education. I'll turn it over to you, Dr. Vivian. And you're on mute.
That's a common statement. Oh, you're on mute. Thank you so much. Pleasure to be here today. And I really enjoyed all the previous presentations, particularly Dr. Pizzone's presentation, because trusted messengers are very important, particularly in communities of color. I'd like to share with you information about an organization that I am so happy to be a member of, and that is the African American Health Network of Dane County. The African American Health Network is a local organization that consists of healthcare professionals as well as community leaders that have a mission of improving the health and well-being of African Americans in Dane County. And what's so great about this organization is that it's a group of trusted messengers. So these members of this organization are well known and well connected within the African American community and other communities as well. So traditionally, the African American Health Network has provided educational programs that focus on disease prevention and disease treatment. And because of their strong relationships in the communities, they've been able to make a great impact. The African American Health Network has also partnered with academic organizations such as CARN, or Community Academic Aging Research Network. And their role with this organization is to actually review the grant applications of faculty and research investigators that are interested in conducting research in the African American community. And members of the network provide these investigators with information that will help strengthen the research effort, and they ensure that the research is appropriate for the community and that it's culturally sensitive. Now, recently, the African American Health Network received funding from the Wisconsin Department of Health Services to actually provide education about COVID-19 as well as the newly released vaccines. And I'm sure everyone is aware of the recent publicity about African Americans having the lowest rates of being vaccinated within the state of Wisconsin as well as other parts of our country. So what the African American Health Network did was we partnered with several community organizations that actually provided services for African American neighborhoods. And we decided that we would offer educational programs at these centers, as well as a mobile vaccine clinic. So people within the neighborhood could come to the community center, learn about the vaccines and the benefits of receiving a vaccine, and then get vaccinated right there on the spot if they'd like to. And in early April, we had quite a success rate. We vaccinated over 100 people. But what happened is that as we got towards the end of April and early May, we noticed a decline in the number of residents that showed up for the mobile clinics. So we started wondering, well, why was that the case? And what we realized is that early on in late March and early April, we were identifying people that were comfortable with receiving the vaccine. So now the real work was ahead of us, and we had to really focus on how do we reach people that are somewhat hesitant or do not trust the healthcare system or the idea of receiving the vaccine. So because we were trusted members of the community, we actually decided to go on site, to go to many apartment buildings and just hang out with people and talk to them. So more recently, our educational sessions do not include the mobile vaccine component. And what we do is we just invite people to come and have dessert or maybe a light lunch and just talk to us so that they have enough information to make an informed decision about whether or not to be vaccinated. In addition, we also started door-to-door canvassing. And we actually identified 4 or 5 people within each neighborhood who had recently been vaccinated and was well known and respected within their neighborhood. And we asked them to just go door to door and invite their neighbors to meet with us on the weekend to talk about their concerns centered around the vaccine. So that's where we're at this time, and I hope that I can share the outcomes of this effort sometime in the near future. Thank you.
Great, thank you so much, Dr. Vivian. I want to just a reminder to submit questions in the Q&A box. I know we have a few, so I'll turn over to those questions for the panelists. One, I think, is applicable to everybody, but to Dr. Pinzon and Dr. Vivian, how have you tailored your strategies to reach homebound caregivers, right? And thinking about, the importance of tailoring, what, if any, considerations did that come into play, or how did you factor the importance of reaching caregivers into your work?
Well, I can go first. Now, since we started the door-to-door canvassing, if we identify a caregiver or an elderly person that's living alone that would like to receive education at their home or would like to be vaccinated at their home, we actually contact our public health department, and they will send out a community health worker or a nurse to provide education or vaccinate that individual. So that's what we've been doing over the last month, and it's been quite successful.
I think that from us, we have been targeting mostly the large community, but with an emphasis in trying to find different networking strategies. For example, the Latino Health Council also has radio programs that are monthly radio programs that they share information and little snippets that goes in other media. But also, for example, we have a lot of in the partnerships. So some of, for example, Sachin, our influencer for the Oneida Nation, has been working with the Oneida Nation communication specialists, particularly to reach out other networks through other like different Facebook pages and sharing information. And that way we have set up different partnerships for different organizations, trying to target who else are we missing, who else is important that we connect, who else can spread this message further.
Excellent, thank you. And I think that touches a bit on the next question that we have is, what advice do you have for identifying leaders to bring public health messages into the community? Are there any best practices from your work, either in person that you're doing, Dr. Vivian, or digitally that you're doing, Dr. Pinzon?
I think don't reinvent the wheel. The people is out there, you will know who they are. Partner with the people that's already doing the work, and the most important thing is value their work. I think we have seen a lot of volunteer work happening that some people and there's budgets and there's some money going around that there's could be a great opportunity to partner and show the value and provide the resources to those that are already doing it. You can identify it, you will see it, you will know who they are.
I agree with my colleague's statements. In Madison, we know who the community leaders are, and we have done a lot of work through social media. But one thing that we found interesting, and one of our elders reminded me that many people, particularly elders, do not rely on social media. So that's why we've been trying to engage in more face-to-face activities, because we are able to reach more elders that way.
Excellent.
And we also find out the needs of the elders within the community as well.
Excellent. Well, I want to be mindful of time, so I want to thank all of our panelists across the town hall today for an amazing conversation. In terms of, lessons that stuck out to me, and I hope to others as well, are one, the importance of using a social determinants of health lens in the framing of programs, messages, and outreach strategies. In order to do that, the importance of leveraging data, understanding the communities that you're trying to reach comprehensively, contextually, using social determinant of health data. The CDC has amazingly rich data, BRFIS data, et cetera, that can help us understand as public health practitioners our community, and we have to put that data into action. So I think that was a key lesson that we highlighted today. Two, Vanessa Brown in the conversation with Dr. Parker highlighted the importance of transparent and accessible information and education to building vaccine confidence. I think that is a beautiful anecdote provided by Vanessa in that conversation. So making sure that we're doing what we can to make this accessible to communities, including our homebound seniors and individuals touched by dementia and their caregivers. Three, culturally tailor, the importance of really thinking through what that means. It's not just about translating something from one language to another. That is the beginning of cultural adaptation, but is not the full picture. So really thinking about and leveraging data to understand who the right messengers are, what the right approaches are, being rigorous in your analysis, as Dr. Pinzon highlighted literally in real time, what that looks like, and the return on investment of that adaptation is clearly a critical. So making sure that we're thinking about adaptation broadly. And then four, go into communities. The critical importance of doing the work that Dr. Vivian is doing, of knocking on doors and engaging and understanding that there are some folks that can't take advantage of our online resources that we're developing around dementia education, around COVID vaccine education. We have to think about the importance of homebound individuals and the folks that are caring for those individuals in the development of our programs. So thank you all for the work that you're doing as advocates, as public health practitioners, as caregivers, and as individual neighbors and community members to address both brain health equity and our response to COVID-19. We will send out after this call a breakdown of all the resources and the presentations that were shared so that you have that accessible. Thank you all. Take care and stay healthy.